Hi, my name is Yasmin Tarehi, and this is Startup Confessionals, where we interview startup founders and entrepreneurs in the Middle East and Africa. We'll learn about some of the biggest lessons these founders discovered on their journey from the personal to the professional and share how they keep themselves motivated. Today's episode is with Jalil Allabadi, who co-founded Altibbi in 2011 with a mission to provide accessible healthcare to everyone. During the past 8 years, Altibbi has grown to become the largest digital health provider in the Arab world with 2 million plus pages of content, 24/7 telehealth service in 12 Arab countries, and 500,000 daily users. So I'm so excited to welcome Jalil to the show. Welcome, Jalil.
Hi, Yasmin.
So, Jalil, can you, let me actually say your name, Jalil. Can you briefly share the value proposition of Altibbi in your words with our audience?
Sure, of course. So with Altibbi, we aim to cover the entire patient journey end to end when it comes to healthcare. So our motto is better health for all, and we strive to work on providing the information, the necessary information, and the right connectivity with doctors along their health journey in order to provide better quality at much more affordable prices than what is available in the market today.
So, Jalil, can you actually walk us through what the product looks like? So if I was to log on today, would I be able to search for doctors or medical providers for specific categories? Like, how does it work exactly? Can you walk us through that?
Sure. Yes, you can look for providers, but not only that. You can actually search for anything related to any symptoms, treatments, conditions. Think about it as a WebMD for in Arabic language. So you can look for anything related to healthcare, whether that is a condition, a symptom, etc., or a healthcare provider, hospital, or pharmacy around you, etc. All of that on the website. Then, if you want to talk to a doctor right away, you can actually have a consultation with a primary care physician in under 3 minutes. You can get on a call with this physician and have a 20 minutes conversation. You can attach your any pictures, tests, lab tests, etc. To aid the conversation. At the end of that conversation, you get a memo from a doctor, telling you the diagnosis, the treatment that is required, the next steps, and if, for example, you'd need a secondary opinion from a specialist doctor, then we recommend specialist doctors with whom you can book an appointment, whether that is a virtual or a physical appointment. And if you end up going to that or talking to that specialist, in most cases, that specialist is using our clinic management system at their end, so that all that data is, again, recorded and logged at every single touch point of that journey. And we're building on top of that to start predicting and advising you for the next steps and how to manage your health going forward.
Wow. So it's kind of like a end-to-end solution for anyone who really is interested in medical care or has any questions. So it could be something very simple to something much more complex. Wow. And so I imagine that the business did very well during the COVID pandemic, at least the height of it.
Yes, we were proud to be able to help in multiple locations. So basically, we ended up working with the government of Jordan, with the Ministry of Health, to provide 24/7 COVID hotline that we're serving close to 20,000 consultations every day for people who needed to know and or even diagnose for COVID at certain points when the crisis was at peak, and to help alleviate the pressure on the public health infrastructure. We did the same then in Egypt. So we still are running the 105 COVID hotline in Egypt, and there the peaks reached close to 30 or 40,000 consultations per day. And we've been helping in both cases, and we thankfully, I think we supported more than 3 million people throughout the crisis so far.
Wow. Amazing. Wow. That's incredible. So do people have to subscribe or pay to be on the platform? Is that how it works? Or do you only pay once you get services from a medical provider?
Yeah, it is a subscription-based service when you want to get on a conversation with a specialist. But it's still very affordable. We're talking about an average of $5 a month to get unlimited primary telehealth consultation with physicians, 24/7.
Wow. Amazing. So, Jalil, can you tell us why you started this company? Can you walk through, how it changed from where it was 8 years ago to where it is today, and really just your reason for starting Altibbi?
Yeah, it is not the traditional story of a company because it actually started as a book. So my father is a surgeon, and he used to work in refugee camps around the region, providing medical services. And one of the things that really kept striking him is that people have very little knowledge about how to manage their health in this part of the world. There's very little education or information around to help people manage their healthcare, and there's a lot of reliance on the healthcare providers, which are lacking in the first place. And that's why he started writing a medical dictionary, because the first problem we have in this part of the world is that medical education is still in English. So even if the patient reaches the doctor is actually taught in English and is incapable of relaying the right message. So my father thought that was the primary problem to solve, and he wrote the first Arabic medical dictionary, and of course that went into libraries and universities, and then. We had that conversation once of how to spread that knowledge. How do we get it into people's hands and really help people manage their health? And that's when we decided to take this whole thing online. And I took over and I started a company to do that, putting all this content online and building that knowledge base, or offering that knowledge base for free to people around the Arab world. Today we have more than 650,000 unique people visiting this website and gaining from this knowledge every single day.
And it's so beautiful to hear the context and the backstory from your father, and how that it probably made it a lot easier to start indexing some of the pages
Right.
online, right, to make it much more accessible.
That's right.
Wow. So, and you said that you are in 12, is it 12 Arab countries right now? And I'm just curious, are you planning to expand to other markets or predominantly just in the Middle East? And if so, are you planning to expand to the other countries in the Middle East?
Definitely. Today we are covering about 14 countries in the Middle East, and our plan is to expand to cover the rest of North Africa. So far, we reach only as far as Libya. So we want to cover Tunisia, Algeria, Morocco, etc., and provide our services in those countries. And then after that, the plan is to expand beyond the Arab world. We think this is a problem that is not only an Arab world problem or a MENA problem; it is an emerging markets problem. So we want to expand that to provide our services in sub-Saharan Africa and Pakistan and other countries in this part of the world.
So, Jalil, how, when you're kind of building a company, I imagine there's many stages and a lot of roadblocks and challenges along the way. And so I'm really curious to hear about some of the biggest moments of adversity or some of the biggest challenges that you've had over the last 8 years and how you were able to overcome it. I think for a lot of people who are interested in starting companies, I think they really want to hear what those moments are like and how to stay resilient in the moments of challenges.
Yeah, this is a tough question in per se, uh, because most of what people hear about when they hear about startups is, the glamorous news, the IPOs and the buyouts, etc. But they don't realize how much effort is in there, and sleepless nights until we reach any milestone. So yeah, I don't know where to start, but yeah, it's been a tough journey from day one. So since I decided to start this company, it meant that I have to leave a secure job, leave stability, and really embark on a journey of which I knew nothing. And I I had to take that leap of faith. What always helps in these decisions and moments is kind of a naive kind of optimism. You keep being optimistic even in the dark night, sleepless nights, and even if you're facing all the adversaries, it's just you keep believing it will get better. That's the only way you get through.
Yeah, yeah. Wow. And I can imagine that, the challenges are changing and they're probably very different depending on the stage of the company that you're in, right? Like in the beginning, there might be more focus on product, later on, more focus on human capital management. But I'm really curious, like how things changed in your mind since you raised your first round, and also how did you start the company? Were you bootstrapping? How did it start?
Yeah, we started it bootstrapping. We really bootstrapped for 5 years, or bootstrap meaning that we lived off our own revenues, so not raising any money. We relied on advertising and partnerships, and then we decided to launch our primary care telehealth. And for that, we had to take another leap of faith and really stop all kinds of advertising because we thought they were a distraction. And that's when we decided to take on our first round of investment and get into that other new journey of investors and shareholders and all of that. So yeah, definitely different moments, different challenges along the way. At the very beginning, bootstrapping was super, super tough. It still is tough, but it was even tougher back then when we started. And I remember the toughest part was actually convincing my tech co-founder to join at the very beginning. That was a super tough thing because I had nothing. I just had the content I am taking from my father's dictionary, and I had no track record in doing anything related to tech. And I had to convince someone to jump in, take a lower salary than whatever he or she is taking outside there, and convince them to join in. So yeah, that was the first real problem. It took me a while to get someone on board.
So fascinating. And Jalil, what do you think, looking back, you learned the most about yourself in this journey? I think a lot of people talk about the destination, where you are today. But I think what's interesting is like the person you became on this journey. So I'm just curious, like, what did you learn about yourself?
I learned way to become way wiser than when I started. I can tell you that. You take things with more philosophy, less personal. Um, I discovered I am actually more resilient than I thought at the beginning. I'm still here. I'm still standing, and I would not have expected this of myself at the beginning.
And Jalil, I want to take it back to the product itself now, because I think something we have not talked about is like how to work with your customers, right? So you have all these customers. It's almost like a two-sided marketplace. So you've got the medical service providers, and the specialists, but you've also got these uh, customers who are anyone who has any kind of medical ailment, pretty much any human being. And so, how do you develop a relationship with your customers? Like, how have you developed this relationship? Is it just primarily focused on giving them really great customer service? Like, what has been your philosophy? Working with customers, do you have focus groups? How do you get feedback for how you want to change the product roadmap with them as well?
Uh, Super interesting question. Um, there are so many ways of getting feedback from customers. Of course, surveys and focus groups, and even just randomly calling on people and asking them about their experience. After a consultation, the ratings of consultations, ratings even on the content pages. So there are so many ways of getting that feedback, and yet I find the most relevant feedback coming in the form of usage. If you see people are coming to using your service, people are coming back to your service, then you realize you're doing something right. This is the most important thing. And then, of course, you want to understand if there are failure points or even more successful touch points. You want to build and focus on the failure points where you want to improve. Of course, it's all important, but the most important thing is, are people using the service? Are people coming back to the service or not?
Got it, got it. And the I always measure the product success based on what already exists in the market at the time, right? And so, what has been the alternative for people? Obviously, going straight to the doctor themselves, like in person, is the, I guess, main alternative. But are there other companies that are doing what you guys are doing? It seems like, just from, my very basic knowledge, there's some companies that are doing telemedicine, but not the content discovery piece. I don't know anyone that has been able to index an Arabic medical dictionary. So, yes, I'm just curious about that.
Uh, so actually, when we started the primary care telehealth in this region, nobody else was doing it. So we actually created this market here, and now there are close to 10 other companies doing it. But the scale is quite different in terms of numbers of consultations and reach. But we don't look at that as an alternative, because the pie is still too narrow to think about that. But the alternative is actually those, as you mentioned, those visits to the hospitals or clinics that are actually that could be replaced by a telehealth or telemedicine consultation, and that's where I see the biggest, waste of money, of potential, of time, and even of effort for the public infrastructure, healthcare infrastructure. Governments are always under pressure to keep building hospitals and hire doctors, which I believe, and the data shows, is actually unnecessary. We can replace a lot of that with telehealth and telemedicine. This is what we are actually striving to replace.
Yeah, yeah. I love that. I mean, I think it's so spot on, because there's been so many medical visits where I don't think the doctor has, touched me even once. It's all been a conversation. And I, sort of think to myself, wow, I don't know why I came here. So I love that. And I think I want to also double click on something you mentioned very early on about your product. You said that to me, this is like this end-to-end solution. And I think the data piece, like being able to see trends over time, and also, help customers understand a little bit about their journey. Because I think so many of us, we don't really know what's happening with our health, right? Like, some of us go to a doctor once a year. Some of us don't go to a doctor at all. Like, we wait until something happens until we go to a doctor. And I think what's interesting is that no one's really paying attention to we count the steps that we walk every day, but we do not, have any interest in, or, capturing the data of our health. And I think the fact that you guys have built that has been so interesting to me, because I think that a lot of companies in the U.S. haven't been able to do that, to unify data across the board. And to show people, like, hey, this is the journey that you've been on, and these are all the data points that you should be aware of, right? Some sort of even predictive capability.
It is really tough, actually, especially in developed markets like the US. That's the irony of sorts, because in the US, most of the healthcare ecosystem is actually already digitized. And it's very hard to connect these dots, because when you digitize, you're digitizing it in your own form, your own formats, your own templates. And it becomes really hard to connect with the other pieces. So we have this advantage in this part of the world, which is that most of the healthcare ecosystem is still undigitized. It's still pen and paper, which actually gives us that kind of advantage in pushing our solutions and connecting these dots end to end with our own kind of data formats and data protocols along the way, and collecting all this data. The, the other issue with healthcare is that healthcare is not a transactional thing. It's not, food ordering. You don't just go to the doctor when you're sick, and then that's it. And the next visit to the doctor is completely independent on the previous one. It's actually the opposite. Each and every single interaction with healthcare is completely dependent on the previous one, and it completely affects your next one. If we succeed in collecting these touch points, we can start predicting what would happen next and start affecting those decisions of the future, and helping reduce those future, let's say, problems coming forward. This is where the beauty of data is.
Got it.
And this is why it's so important in healthcare versus any other industry.
Yeah, it's like building on top of what happened before. And yeah, it's interesting that your market is much more ripe for that. So Jalil, I want to switch gears and talk a little bit about the people that influenced you on this path. Was there a person, a mentor, it could be a partner, family that really kind of held you to your highest standard, let's say, for you to keep going? I always think like it's so funny. We talk about founder stories, but I think a lot of founder stories actually have family stories behind them where, the family is like really involved in supporting the founder. So I'm just, curious, like, has there been a mentor or a person that really helped you stay the course on this journey?
Definitely, I'd start with my father. He's the original inspiration behind the whole thing. He kind of instilled this, you know, love of creating a real change in the world, I, I kind of feel I owe him this every single day. So that's the primary thing, and then another inspiration. Yes, of course, it's my mother who actually joined a startup manufacturing company a long time ago, and she was part in creating one of the greatest success stories in the Arab world, which is the largest Arabic pharmaceutical manufacturing company. And that always remained as an inspiration, witnessing that growth of that company since I was a kid, going with my mother to the office and seeing how she does that, how dedicated and passionate about her work. And the founder of that company who actually also believed in creating something big and impactful out of this part of the world. That really kind of shaped my way of looking at things. I still want to and dream of making Altibbi a real success story that has real impact on the lives of people in this part of the world.
Wow, that's so inspiring. That's amazing. Two powerhouse parents. That's amazing. Wow. And Jalila, is there a book or something that you're reading now that has deeply inspired you? It could be a book that you read, even 5-10 years ago. But yeah, I'm just curious if there's anything that's that you remember that has inspired you, an author or person.
I read a lot, by the way, Yasmin. So this is a very challenging, but the book that I just read last month, and it's still, I'm still dreaming and thinking about it, is Factfulness. I really it kind of shook a lot of my beliefs. So I love that book.
Jaleel, is it called Tactfulness or Factfulness? What was it called?
Factfulness.
Factfulness. Oh, got it. Okay, I would love to hear more about that book. And you were about to share others, so I apologize.
No, I mean this is the one I am reading now. Disruptive creation. So this is another book that is actually I'm struggling with because it has a lot of new concepts. So I'm looking at it. I'm in it right now, so I can tell you about it in a month's time.
Amazing. So factfulness, disruptive creation. Was it disruptive creation?
Yeah.
And then okay, so we'll look at those two books. I love asking this question because I often will buy the book based on your recommendation. So yeah,
Factfulness is a good one, actually. You should try that.
Okay, what is it about? Just like high level, can you share with us?
It is about how to look for facts and make decisions based on facts. Because by reading that book, I realized that we make a lot of decisions based on perceptions and based on kind of unbased. Unbased is that the word? Unbased facts. We assume that this is the way it is, and in reality it's not. And if you dig deeper and you realize the facts are completely different, and it's kind of inspiring when you think about it that way.
Yeah, the unconscious kind of, beliefs that we have about so many things. Okay, I will definitely check that out. Amazing. Jalil, what is your main takeaway that you want to share with our audience? If you could tell the world anything, what would it be?
Wow.
It could be like on motivation. It could just be on, like, what would you tell maybe people who are starting their own company, people who are interested in starting a company, or even working for a startup? It could be about health, like just anything that's sort of like your main takeaway. What would you tell your children as like a
Yeah.
the honest truth, right?
Don't
do it.
I remember my father when I was a kid. You always look after your parents. You want to become like them. And I remember I once told my father I wanted to become a doctor, and he was like, "No, you never want to do that. It's not fun. Don't even think about it." So I might be telling my kids the same one day. But yeah, I do love what I do. I do love having created Altibbi. I do love every single day waking up to the thought that I am in a position to actually work on my dream and have in my hands the power to do it. Uh, and I want to succeed at it. So throughout the sleepless nights, difficult days, successes, this is what always keeps me going. And if I want to tell anyone who is starting a company anything, I would tell them that it is not easy. It is really not easy. Don't get fooled with the headlines and the glamour around that. It's completely unglamorous, but it is super 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 fun to feel in power of doing the thing that you want to do.
Amazing. That's really powerful. Thank you so much, Jalil. I really, really appreciate that. So we are wrapping up, but I'm so grateful for your time, Jalil. And can you point folks to resources, website where they can learn more about you and Altibbi, how to get involved, and anything else that we could support you with?
Thank you, Yasmin. You can reach out on LinkedIn. I'm there. Our website is altibbi.com, and there you can find the contact us information. You can always reach out, and we are ready to listen to feedback and listen to ideas, suggestions, anything. And happy to talk to anyone.
Amazing. Okay. And we'll leave all the links in the show notes as well.
Thank you very much.
So thank you. Thank you so much for your time. And for our audience, thanks for joining and for listening to Startup Confessionals.